Hello and welcome back to Study More Hygiene. In today's video, I want to talk about different types of tooth staining. So there are actually two types of stains. There's intrinsic and extrinsic stain. So we'll go ahead and start with intrinsic stain. So that's a stain that's incorporated within the tooth structure itself and cannot be removed by scaling or polishing. These stains result from alterations during the development of the tooth associated with antibiotic use, fever, trauma, infection, and ingestion of high amounts of systemic fluoride. Some examples of these stains include dental fluorosis, which is described with white spotted to brown pitted enamel. And again, this is from excessive fluoride ingestion during enamel development. This cannot be removed by scaling or selective polishing. The next type of intrinsic stain is hypocalcification, or white spots on the enamel. This is due to like a high fever during enamel formation. Again, cannot be removed by scaling or selective polishing. The next type of intrinsic stain is demineralization, which is described white or brown spots on the enamel, may be smooth to rough. This is due to acid erosion of the enamel caused by oral biofilm and poor hygiene. So again, this cannot be removed by scaling or polishing, and it is recommended to use a sodium fluoride rinse to remineralize this tooth structure. The fourth type of intrinsic stain would be a tetracycline stain, which is grayish brown in color. This is due to ingestion of tetracycline during tooth development. And again, this cannot be removed by scaling or selective polishing. So that covers intrinsic staining. Now moving on to extrinsic stain. This is stain that occurs on the tooth surface, usually can be removed by coronal polishing or scaling. The method of attachment is the acquired pellicle. Without the pellicle, stains cannot adhere to smooth enamel surfaces. Extrinsic stains develop because of the presence of chromogenic bacteria or color-producing bacteria, use of staining substances such as tobacco, red wine, tea, coffee, soda, blueberries, and some drugs with exposure to metallic compounds. Of the extrinsic stains, green stain is caused by chromogenic bacteria and fungi from poor oral hygiene, most often seen in children with enamel regularities. This stain should not be scaled because of underlying demineralization of the enamel. So we would have the patient remove this stain during toothbrushing instruction, or it can be lightly polished. The next type of stain is black stain. So the source, this comes from iron in saliva, iron containing oral solutions, industrial exposure to iron, magnesium, and silver. So to remove this, you can firmly scale the stain. It's going to be hard like buildup, and you can selectively polish to completely remove the leftover stain. The next type of extrinsic stain would be orange stain. Again, a chromogenic bacteria, and it's due to poor oral hygiene. This can be lightly scaled and then selectively polished off. Another type of extrinsic stain would be brown stains from tobacco and food. So tars from smoking, chewing, and dipping spit tobacco, as well as food and pigment tannins. So the brown stain from pigment tannins, we can think of things like a Coke or a Pepsi or a dark soda. These can both be lightly scaled, then polished selectively for both the food and tobacco stain. Topical medications like stannous fluoride, chlorhexidine, chloride mouth rinses, these can also be lightly scaled and then polished selectively. Yellow extrinsic stain comes from oral biofilm. This can be removed easily during toothbrush instruction for your patient. Again, there's a blue-green stain, which is caused by mercury and lead dust. Again, can be lightly scaled, then polished selectively. And finally, a red-black stain. This comes from chewing betel nut leaf, and again can be scaled and polished depending on how extreme it is. So tooth stain in general is a discolored area on a tooth contrasting with the rest of the tooth color. Sources of tooth stain can often be identified by the color of the stain and the client's self-reported information about lifestyle behavior, diet, work environment, oral habits. Identification of the stain and its source assists in development of a specific care plan that facilitates stain control, a more aesthetic appearance for clients. The client can often reduce stain formation with improved oral hygiene practices and appropriate over-the-counter product selection like whitening toothpaste, power toothbrushes, and coming in for frequent dental hygiene cleanings. So it's always you have to take every patient's individualize their difference. You have to take all their information about their daily habits. For example, I have patients who need to drink coffee 3 times a day, every day. And with those patients, they some of the time try to come see the dental hygienist more often for cleanings. Maybe they come in 4 times a year just to get more cleanings more often. Some patients I see, they are a heavy smoker, so there is a lot of staining going on there. Again, with those patients, we try smoking cessation or trying to help them move away from the tobacco. Again, if it's an issue that they can't move away from the tobacco, it's recommending that they, again, try to come see us more often to deal with that smoking stain. And with the younger pediatric patients, it's really important to have discussions about their diets. I know I see a lot of patients, they eat a lot of foods with lots of colors and dyes in them. Some things that come to my mind, first things that come to my mind would include like hot Cheetos, regular Cheetos. That orange color can get stuck in those stain, in the grooves and fissures of those teeth. Other things like different soft drinks that can demineralize the tooth structure, like sodas, bubblies, water, sparkling waters, things like that. They are all acidic and they have a chance of doing some damage to that tooth structure, breaking it down, even discoloring it to a point. And with that, we recommend, like I said earlier, different types of toothbrushes, like our electric toothbrushes, which could often help remove some of that staining themselves if they're using a manual toothbrush before that. And just also getting the toothbrush in their mouth more often, building good habits. When they have those good habits, there's less chance for stain development.